What is the mechanism of heart murmurs? Heart murmurs occur due to the creation of turbulent blood flow, caused by pressure differences and gradients between two chambers. Hello, hey. In this video, we want to learn together the mechanism of heart murmurs in a simple, understandable, yet completely scientific way, in a way that it will be etched in your mind forever. In a normal and healthy heart, blood flow is laminar, meaning concentric circles, flow within the heart or vessel, which we call laminar flow. But when there is a narrowing in the path of blood flow, it causes a pressure difference between the proximal and distal parts. Or in other words, a pressure gradient is created. And this leads to the laminar blood flow, which is completely orderly, becoming turbulent after the narrowing, meaning the layers of blood move in different directions. Here we say the blood flow has become turbulent. So therefore, any factor that causes a pressure difference and gradient between the proximal and distal parts of the vessel or between two heart chambers will cause the laminar blood flow to turn into turbulent flow. And this turbulent or rushing blood flow creates sound. And when we place the stethoscope on the heart, we hear this turbulent and rushing sound as a murmur. Imagine a river flowing through a flat plain. This river does not create any sound because the water flow is completely layered and orderly. But if this same river passes through mountainous areas and between gorges and rocks, due to the gradient difference that arises between its proximal and distal parts, the water flow exits its laminar and orderly state and becomes turbulent or rushing. In any case, this leads to the production of sound, and we might hear this sound from a long distance. Or consider a garden hose that you are using to water the garden. Normally, when you place your hand on the hose, you might feel a slight vibration. But if you hold both ends of the hose and bend it, because you have created a constriction and compression from the outside, it results in a pressure difference between the proximal and distal parts, which in turn leads to increased turbulence of the water flow and consequently increased vibration. And you feel a very strong vibration under your hand. Or imagine placing the same hose on the ground and stepping on it, applying pressure. The more pressure you apply, because the compression and constriction from the outside increase, it leads to increased turbulence of the water flow and consequently an increase in the intensity of the vibration you feel under your foot. It's exactly the same in the heart. The greater the constriction, the greater the pressure gradient difference becomes. The turbulence increases and the murmur sound is heard louder.